So, on your side mirror this morning, we are mirroring the impact of quackery in nursing standards, a call to action in Lagos State. So, while we're doing that, we're seeing some levels of quackery, those who are calling themselves professionals who are not, and people are unfortunately falling into their arms. And the government is saying we cannot take this lying low. Let's speak with someone who's been in the profession for several years. Mrs. Sola Aketi is Director Nursing Services with the Lagos State Ministry of Health. Madam, it's nice to have you join us on the program. Good morning.
Good morning, sir.
All right, so it's
Good
nice.
morning, Mr. Victor.
Good morning.
And good morning, the entire Lagosian.
Great.
Nice to be here this morning.
All right, so we're talking the nursing profession, and of course, it's a profession that is very, very crucial to our survival as human beings. When you assess it in Lagos, so far so good, how are things faring with the nursing profession?
Thank you so very much. Once again, I want to say congratulations, Mr. Victor. I came across your VP this morning and I saw what is happening 20 years along the line.
Thank you.
It's a medium of celebration. Congratulations, sir.
Thank you, madam.
However, nursing in Lagos has been thriving very well. Lagos, like I said, is a country inside a country. Lagos is where it happens. When it comes to anything, education, health, considering Teams Plus agenda, the current administration, they are really working hard to sustain it. And I'm happy for the previous leaders. So nursing in Lagos has been one of the eye-opener to many people that so nursing is highly enterprising. It's a profession that everybody premised on. That without a nurse, I'm sorry, the earth will have been weakened. As we have over 60% of workforce in nursing.
Okay.
In globally, taking care of the sick, the indigent, the vulnerables, and the lives. Nursing is a profession to be proud of.
Which is
and
very,
Lagos State, it was given the consideration, high consideration for that.
Okay then, so that sounds nice. You've really qualified it in a positive way. But some trends that are very, very disturbing. We're finding out that we're having some increased levels of quackery in the profession. Talk to me.
Thank you so very much, sir. And I'm happy that you are partnering with us in this advocacy. Quackery happens across all professions. But when it happens in a very dangerous environment like nursing, you need to shout. What do I mean? There are so many avoidable deaths that will have not even come to the table. But because it's being handled, their life is being handled by the so-called quacks. The word quackery, quacks came from the word quackery.
All right.
So, by the time you lose that life, you can't get it back. And that is why we are shouting now. Quackery in nursing profession generally refers to the fraudulent or deceptive practices which an individual falsely claims to be. You want to be a qualified medical doctor, you go to school. A qualified teacher, you have to go through training. Qualified nurse, you have to go through the training. But when you are being trained by unregistered, unclaimed elements, anything can happen. And that is why when they die, nobody sued them, no litigation, nothing whatsoever. But for a professional of any sort, once there is a mismanagement or malpractices of any sort, rest assured that. And in that way, they're highly ineffective and they carry out harmful treatment. So this practice is a great public health concern for us in Lagos State, and we cannot keep quiet any longer.
All right, so let's look at it. How is the ministry, finding out all of this? Is it to say people are reporting, or is it through your monitoring that you've come to find out that we're having some heightened levels of quackery in the nursing profession?
Like I said, quackery is an unregistered, unqualified, untrained element that proceeds to be one. Now in Lagos State, they frown at it marvelously. Why? Because that age, health and environment in our Teams Plus agenda is being optimally uplifted. All segments are working towards enhancing health in Lagos State. And so this practice in Lagos State, the current administration and the stakeholders in next ministry, they frown at it. recently we discovered that people are just opening, they call it school, opening shops.
Okay.
For instance, this year alone, we have sealed up to 4 with a notice. Because in Lagos State, there is Directorate of Nursing Services and Lagos Ministry of Health has the prerogative to work with other teams. That is the NAM, that's association, the FAMA, the regulatory body, the Nursing and Midwifery Committee of that state. So when we work together, we give them notice. This thing you are doing, no guidelines, no support from the regulatory body in Abuja, close it down. Example in case was that of Berige, Sola College of Nursing recently.
Okay.
January 19th, the advert came, and once the advert came, people will come and ask me, there is this school, can we apply? That's why most of them we got to know of them. The people in the neighborhood, that's why they should keep giving us more information. Can we apply? If my daughter or my wife finishes, can he get employment with Lagos State? And when I got to know of that, January 19th, on 28th, we took up the case. We went there. We saw them training, they're already in 300 level, training these ones, almost 80. I said,
wow.
No regulation, no backup, no guidelines, nothing. And it was not accredited by Nigerian Board of Technical Education, ETC for college, and neither is there any NUC accreditation, and no regulation from my regulatory body, which is Nursing and Midwifery Council. So we gave him a warning. And following it up, by February 20, we started a paper.
Right.
To ask that place, please accept it. The curriculum was as far.
Right.
No enough notice. And lo and behold, on the 1st of November, the front page, Saturday Punch,
right,
exposed illegal training. It was a shame. It was an indictment of the state, and the state frowned at it. Currently, the normal course he's facing it with the government.
Right.
With the government.
Okay, so we have
in Lagos. Of recent, we saw so many around the Badagry as well. We went there, we gave him notice. Please close it down. If you want to, we have only 6 colleges and departments of nursing in Lagos.
Okay, just hold on one second.
That are coming up,
just hold on.
Okay.
Yeah, just hold on one second. We'll talk about those 6. But the flash update from the Dokpemu end says that that broken down vehicle that we reported earlier on, just around Goyi, in front of the UBA end there, I understand has been fixed. And it has been taken off. It's a mini truck, by the way. So that is off the road right now. And those of you within that particular corridor will have a thoroughfare right now. All right. So let's talk about that again. You said we have 6 colleges of nursing in Lagos?
For instance, now, before it used to be schools of nursing, no more school. It's now college. All of them have been transformed since December 2023.
Right.
To operate colleges of nursing in collaboration with Nigerian Board of Technical Education and Nigeria University, Nursing and Midwifery Council of Nigeria.
Right. So where are they located? Where are these 6 located?
Oh, Lagos State College of Nursing is at Igodo, inside Alimosho General Hospital.
Right.
Nigerian Army College of Nursing is inside the Military Hospital at Yaba.
Okay.
National Orthopedic Hospital, Igobi College of Nursing is right inside Igobi. Then College of Nursing Lutz is within Lutz. When you get there, you can go and find it. And the mode of entry is too jammed. Now the department we have Department of Nursing Unilag, Department of Nursing Lagos University Teaching Hospital, Lagos State University, Ojo. But that one is at Ojo, but at Ikeja, Lasuko. And again, we have Department of Nursing, Trinity. There's another one coming up, Maranatha. And these people have gone to Nursing and Midwifery Council, and they got the code of ethics and guidelines, and they were able to open anytime they want to do accreditation, which is every for 4 years. We go there to assess, are they still practicing standards? These people did not go through any medium because no formal education for them, no professional licensing. They are not adhered to ethical conduct. So, code of conduct, at the end of the day, ethical code, beg your pardon. At the end of the day, you just have to lock them up because the life of our people are not safe with this kind of quackery in the states. All
right, then Lagos Traffic Radio 96.1 FM, another 40-foot container laden truck. It's a cold room, I understand, with mechanical faults at Apapa Jegule, just by the billboard there. Okay, but the good news, it has been taken off. Yes, so that has been resolved. the billboard on Marine Bridge. All right, so that one is another good news for those of you who are navigating through that corridor as well. All right, so Sola, Aketi, all these that you're talking about, they are all training institutions. They are fake training nursing centers, so to say. Is that it?
Yes, they are training institutions. They are where our students can, they affiliate with some of these hospitals where our students can go for their clinical experience. And when they finish, they'll be licensed and at the same time be monitored accordingly. So these are the recognized institutions. Others are coming, but for now, we have not gotten accreditation, or the accreditation process is ongoing with the regulatory body. And once that work is done, I'll be notified in Lagos State, and they'll be considered as well.
Okay, let's talk about those who go to hospitals, or perhaps who go to clinics, or perhaps primary healthcare centers around them. How can one identify a truly certified nurse, or how do we know if this nurse is a fake one, or somebody who's practicing quackery, so to say?
Thank you so very much, Mr. Moderator. Let me quickly say this, that if I tell them how to know, they will not know the implication.
Okay.
How do you know if that person is a qualified? Number one, you ask for a license. Ideally, it's supposed to be either in scroll with your name on it, or you have your tag placed on yourself with a word registered nurse. Two, that person who employed him will have known that this is a nurse. And if you ask the owner of the hospital, is this person qualified enough to, they will tell you yes. The reason why we are saying that is that Quackery is plaguing and promoting our challenges. Okay. Somebody that's supposed to be given a quick intervention, you just see them wasting money because of what? Wrong diagnosis. It has a lot of implication, which I will talk about, impact of this quackery. So you can ask them, Madam, are you a qualified? Because I want a qualified not to attend to. You have the right to ask. Just like you have the right to know the kind of treatment you are going through. You are in an enlightened environment now. You have every reason to know who is taking care of you. But unfortunately, we don't practice such. Just like I cannot ask a teacher, are you a qualified teacher? No. But because of intervention, in the course of doing what is needed to be done, you will see often than not that these people are not skillfully practicing what they're supposed to. Of recent, I met one of them. She doesn't know what it was. In the course of my interaction, she looks so perfect and she dressed well. Only to find out that she's a quack. She says she's from one of the university in Southeast. So on the investigation, they called that school, no traceable name. And they are already forming a syndicate in Lagos. Okay. And that is why I say no practice of such is allowed in Lagos.
Now, let's begin to get the clarifications much better now, because I know before now we had those that were referred to as auxiliary nurses. Is that correct?
There's nothing like auxiliary nursing.
Okay, so tell me.
That's the message. There's nothing like there's no auxiliary doctor, no auxiliary teacher, no auxiliary pharmacist. Sir, there's no auxiliary nurse. Anyone that says an auxiliary nurse will have known that this is a quack.
Okay. So
they are the one that has been trained under one hospital, one man, whatever.
Okay.
We want those people that are training them, stop training these people, or else you come to the book of the mistakes. I said this current administration frowned at me, because why am I so passionate about this? Because of these people, at the end of the day, because of their quality and lack of exposure or skill, compromised treatment, wrong diagnosis, medical errors, poor record keeping, name it all. They did not allow many people to have trust in our care. So there is erosion of public trust. And by the time they take them to our hospital, for instance, somebody who you have already misdiagnosed or mismanaged, at the end of the day, refer them to lose or refer them to last week to be precise. At the end of the day, the patient died. Because as of that time, there's no way you can salvage that life. Tell me, who will you think killed the person? My sister died last week. My cousin. I don't trust it. You are already eroding the trust you're supposed to have, because they did not come to us as a first contact. You have already, like I'm talking to you, sir. I have a case at hand that he was rushed to an hospital because they said there's no best place, go to this hospital and assess your care. He took the person to another private setting. Who knew who manages what? As I'm talking to you, the person had gangrenous leg foot.
Wow.
If there is a diabetic patient that's supposed to be on regular treatment so that the trigger of that skin can come up.
All right.
We are planning how for what amputation as I'm talking to you.
Which is quite unfortunate.
So, exactly. They will not come to our center after they have already destabilized them. They take enough from them. They put them out. Who are those managing them? Then quacks on investigation. And so a farmer is really against this. That is Health Facility and Accreditation Monitoring Agency, who we are partnering with. And National Medical Committee of this state say no way, enough of this. And that's why we are shouting out. If you love yourself, even if they tell you that, oh, there's no best place in God, because many people are now coming to assess our facilities. Always ask for the identification of whosoever is attending to you. Are you a registered? Because all public hospitals, they employed registered trained nurse. That's why if they misbehave, I'm sorry, they face the wrath of the law.
Right.
But in this private setting, if they misbehave or they mismanage, what did they do? No compensation, no litigation, nothing whatsoever. They say, I'm alone. Who says? So we have got it to a level. This is an understanding error. Social media has already made everybody to be well knowledgeable of what you are going through.
Right.
So if you misbehave, you face the wrath of law in Lagos State.
All right, then. Lagos Traffic Radio 96.1 FM. This morning, we are mirroring the impact of quackery in nursing standards. And we're saying this is a call to action in Lagos State. And my guest is Mrs. Sola Aketi, who is Director Nursing Services with the Lagos State Ministry of Health. Getting back to the roads before we continue the conversation, we did tell you that the impediment around the Dokpemu end has been resolved. Taking you to the other side of town, Ekpe, to be very precise, the update there still indicates that vehicular movement is very, very smooth. That's from Mojoda, connecting Itamarun as well as Itaopo and Ayeturu, all looking pretty good. We're also having it very, very smooth from areas like Ayeturu inwards General Hospital Junction, linking up with the T Junction, looking pretty good. Temu, Okiosho, down to K2, all those corridors looking good. It's also a very good one from the T Junction, linking up with Alaro City, Elerongbe, all those corridors up to Okeogun and Ibeju, Kara Market, looking very good. Eleganza, Kayeturu, and Eleko Junction, looking very good. The return journey is also good as well. Ikorodu Road is faring better right now. Things are moving much better from mile 12 end, heading towards Koshofe down to K2, approaching Ojota. No major worries. Masha Aguda end too is also looking very, very good. We did tell you that. And let me see, the Lekki Scheme 1 axis, better vehicular movement being experienced from Lekki Peninsula Gate connecting Farm City as well as Road 12, Admiralty Roundabout. All those areas looking good. The return journey from Admiralty Roundabout up to Road 12 and Farm City as well as Lekki Peninsula Gate is also moving with very, very good traffic flow. It's time to also have you connect with us on the program this morning. We're looking at the nursing profession and quackery too. So you've heard my guest. She has spoken a lot. If there are areas of concern that you still like to bring to her attention, you can feel free to do so. All right, that's on 080-99120777. You can put in voice calls through that number now. It's been up and running for over a month now. Okay, 080-99120777 and 091-5387-7127. You can feel free to send in your questions too. Of course, my guests will be there to respond to it as well. All right, so madam, let's look at the impact of all of this. I mean, we're talking quackery this morning. Of what impact is quackery bringing to the nursing profession?
Thank you so very much, sir. I mentioned here when I was in the course of interaction. There are a lot of quackery nursing on the quality nursing care.
Right.
Are profound. They're highly profound.
Okay.
And it starts from patient safety. Patients are not safe. Imagine somebody who has, because of ordinary dressing, they have spent over 1 million. I received this call from a colleague, a diaspora, a retired nurse in the US. That please help me. My sister-in-law is dying. Say what happened? She now narrated until I said, take her to one of our hospitals, the General Hospital. I'm talking, this was last week. So patient safety is being compromised with. Their public trust. For instance, like I said, you are taking them to one place and it was mismanaged or not being well cared for. You ended up in coming to the government setting. At the end of the day, there will be a lot. That's how you see them transferring aggression to most of our nurses. I have been spending money to whom? Is it to the nurses? So when eventually the person did not get well or ended up in mortuary, unfortunately, you will see that they will not trust that center again. They will not have confidence in the discharge or quality service we are rendering because of what has happened to them. What other thing? There are lots of substandard care and negligence. No updates, medical errors, poor record keeping, to mention but few. Patient exploitation, a lot. Now, when it comes to ethical and legal implication, nobody can arrest them. Unlicensed individual may not adhere to strict rules, and nobody will put them to check. Lack of accountability by whom? So we have a lot. Somebody will now tell me, is it not to give injection? No, it's not about injection. It's not about setting of life. It's about giving the quality care. By our scope of practice, it's about making sure that life is preserved. Is it being improved upon? You alleviate the suffering, and you take away a supposed fear. But what do we see? If you come to me now, say, madam, with what I'm going through, what do you suggest? I will give you the true picture because I have the pathology of the disease you are going through. I will start, and I know the possible pharmacokinetics. I can share with you that this is how to go about it.
All right.
And we have so many cultural bases that we need to improve and need to be dealt away with. The culture is dynamic.
Let's take some reactions from the public this morning, the listening public. 08099120777. Feel free to connect with us on the program. This one says, is it true that some people in uniforms claim to be nurses but never went to any nursing school? How does that even happen in Lagos?
No.
Ibidu is sending that one.
Thank you, Madam Ibidu. Not everybody in white is a nurse. Not everybody in house coat is a doctor. Like I said at the primitive, that this quackery cut across. It's in engineering, in education, it's in even in journalism, it's in nursing. But why that of nursing should be upheld ultimately is about the life involved.
All right. Okay. All right.
And so we cannot but sleep and close our eyes to these deterrents. It has to be dealt with.
Okay, then. This one says, good morning, ma. Do I have a call? Hello?
Hello, I'm on.
Okay. This one says, good morning, ma. Is the problem mostly in private hospitals, or do we also see quackery working in government health centers? This is coming in from Shaliwa from Ikotun. Thank you, Shaliwa.
Thank you, Shaliwa. I can confidently tell you there's none at public setting. But if you find out any, let me know. But all this thing, because you go through the normal route or process, the recruitment process will have fished you out. Because when I was serving in the capacity of the zonal coordinator of our mandatory continuous professional development programs in the Southwest, we discovered there was one that came for the program because that was attached to our license, the renewal of license. That if you don't go through this process twice in a year, within 3 years, your license will not be renewed as a capacity building medium. This lady came unassuming. She said she finished it from University of OAU. We quickly called the OAU vice chancellor, head of department. We are happy because they don't know we are connected. The license she was presenting was different from other. There's a way we can identify. And that is why when you say, even of this, we got another one around the Ojo area. They quickly called my office. Please, ma, look at this license very well. Is it genuine? I was able to identify. I said, this is fake. Arrest and take her to police station. Because you are not sure what you are possessing. You went and, before you know it, you're already feeling. So we don't have it at public setting. Wow. I can show you of that.
Okay, then.
But at private, I tell you, they are doing, that's why we are leading to our medical doctors. You are doing a lot. You have invested. Do not spoil it by training this younger one. You are more or less injuring the life of those people that are coming. So pull out a baby is not the way of delivery. Does not mean they are competent.
Right.
So give injection does not mean the person knows. They are not to that. So they should not train them any longer. Among ourselves, which are nurses, we are warned ourselves. Don't train anybody under any building in the name of I'm training them to become. Nobody will certify them. And once they are caught, off they go to Quackery. I assure you, this year alone, 2 people have visited Quackery.
All right.
I'm not saying it to both.
Yeah.
Go and confirm. Lagos State found at it enormously.
Okay, then we have some more reactions coming in from you. 08099120777. This is Mr. Dewale. He says, I used to know a lady a few years ago who worked as a cleaner in a hospital but pretended to be a nurse when she got back home. She even ran a chemist shop where she treated patients and gave injections and drips. There are so many cases like that today. So
Mr. Adewale, you are really right.
He said,
you are speaking to us.
So he said,
how our community?
Yeah, let me learn, madam. He said, so he says, how can one report situations like this, Mr. Adewale?
Thank you very much. Just come to the Ministry of Health. Report the case directly to Permanent Secretary, Lagos State Ministry of Health. They will take it up from there.
Okay, all right.
We have a farmer who is working with, or you come to my office, Director of Nursing Services, Lagos State Ministry of Health, report them directly with an evidence. There are a lot of them. For instance, sir, there was one lady, I was told that just committed or performed abortion for somebody.
Wow.
Anytime the family has problem, that house, if they are this face me, I face you, she would go there, treat them, malaria, whatever. But there was a time she just did only to find out that one of their neighbor was complaining, was bleeding. Eventually, he had to confess to this my Uber guy that I committed, Mama Lagbaja did something for me. I have to remove the pregnancy. Wow. And she bled almost to death until they rushed her to the hospital.
Wow. Kind of
so they are doing a lot of havoc.
All right, so more reactions are coming in for you. Nurse Aketi, this one is from, let me see. Okay, it says, good morning, Ms. Aketi. He said, does your directorate have a task force to monitor private nursing homes and clinics operated by members of your profession just to complement activities of a farmer? Thank you. Wurola is sending that to you.
Thank you so very much, Madam Wurola. This is how it operates in Lagos. We have Association of General Nurse Practitioners, General Private Nurse Practitioners. They have the association. We have Association of General Medical Practitioners. Those ones are doctors. The two of them are viable elements as part of our stakeholders in Lagos State. Then we have Nursing and Midwifery Council of Nigeria as a regulatory body. That's in Abuja. Then we have a farmer, that is Health Facility and Acquisition Monitoring Agency. These people, they are the regulatory body in Lagos to go and supervise, monitor, seal, accredit whosoever wanted to operate private institution. And it's cut across. Even the Association of General Nurse Practitioners, private, Association of General Medical Practitioners, register with a farmer. You wanted to establish anything related to health as an institution, you register with a farmer. So whenever they discover that there is a lapse, for instance, in terms of personnel for nurses, they call me in to come and identify, is this person a registered nurse? And that's why we are saying when you wanted to employ registered nurse.
Right.
But many of them will say they cannot afford it, then don't open the center. It's not necessary you must open when you cannot afford to pay the qualified person.
Right. A
qualified person will give you confidence even when you are not around. And if you find anybody that is operating illegally, report. Ministry of Health is open to you. Please kindly give us information.
All right, then. So very, very pertinent questions coming in from Sheung Ibrahim. He says, good morning, everyone. I am Sheung Ibrahim. I'm just wondering, can technology help? Maybe a public database where we can verify nurses' registration number. Thank you. All right. Thank you so much, Sheung Ibrahim. Madam, what would you say to that?
Thank you, Sheung. Yes, our registration is not open to general, but it's available. Of recent, a young man, they were sent to me to verify the authenticity of our registration. At a click of the button, we're able to provide information. But if you put it to the public like that, we have not matured we are in low and medium income countries. We have not matured to the level on which your information, your cogent should just be on the social media.
Right.
Or available at a click But if you want, come to the regulatory body, come to me, verify information, tell me the name, the school attended, the year finishes, the specialty. If the person is not, he has extra attachment or extra qualification apart from registered nurse or registered midwife or whatever, send the details to me or to this Mr. Oteri, the moderator.
Okay.
They will get the information and pass it across to me. And I assure you, the information will pass across to you as well.
All right.
So we have the database.
Let's begin to wrap this all up right now. So we have some quacks in the profession, and for us to deal with this, madam, what's your suggestion as we round off the program?
Thank you so very much. Effective control measure to put in place. We have started. Number one, stringent enforcement. And that is why I told you we work as a team, collaboration, a farmer, National Military Committee of the State, Director of Nursing Services, regulatory body will come together. And so this stringent enforcement is being backed up by rapid RRS of the state. They are from the governor's office.
Okay.
They are the ones that will go there, identify and make the arrest and send them to the appropriate place. Okay. Public awareness, like the one we are doing now. We are creating awareness to let people know that they should not waste their money. I knew they're under pressure. They need the relief. After that relief, go to the main area where you can get. That's why the government made it 10 minutes away from where you work. You get an hospital. Okay. We have about over 324 primary health care centers in Lagos and 30 secondary level. And tertiaries, last route, Federal Medical Center, Ibute Meta. Now, we have one in Ekpe. We have the government is building another major one at Ojo, indicating that anywhere you are, the healthcare is accessible to you. So don't give any excuses. Again, we are trying to let them, anybody caught, you face the wrath of the law.
All right, then.
Government intervention in this one is to all the private healthcare facilities. Please do not provide or embrace quackery any longer.
All right, then.
Any facility caught in that wise, we face the wrath of the law and face the government.
Okay. We'll leave it at that for now. Madam, it's always a thing of joy to have you join us. Thank you so much for connecting with us this morning.
Thank you so very much. That's my pleasure, sir.
Okay, then. So we've been able to mirror the impact of quackery in nursing standards, a call to action in Lagos State. And if you're wondering who I've been speaking with, Mrs. Sola Aketi is, of course, the Director, Nursing Services with the Lagos State Ministry of Health. And she has a whole lot of titles to her name. She's been in the profession for over 3 decades. We have to go. The program this morning has been produced by Dayo Anthony. I say a big thank you to our social media team, Okoyemi Shodunke, Daniel Downsey, and Remy Aluko. Our executive producer is Tayo Akonle. My name is Victor Oteri. Have a splendid day. Bye.